We will also share a little bit about what our efforts has been around the COVID-19 relief. A lot of you are already partners on that, so we will do that. We've received a lot of questions, from CSRs related to the work on COVID-19, and we will also look to address them today, as like I said, as much as possible. It is a start of a conversation. We are always available at any point in time to answer more questions. And like I said, if we can't cover all the questions, because we got almost about 100, 150 plus questions, over the last few days, we have clubbed them and tried to answer as many of them through the presentation and separately as well towards the end. But in case we are not able to cover everything, we will surely make sure in the next day or so we will have those answers sent you, from our side. And we will keep definitely some time for Q&A to also respond to any questions that may be coming at this point during this conversation itself. So that's a quick, agenda for today. Uh, a quick introduction to Sattva. A lot of you all are friends, partners, customers. We've been working in the space of impact and how do we deliver that at scale for over 10 plus years, working across different stakeholders and doing a variety of things from research to implementation to assessments and talent in the sector. If you need to know more, you can always visit our website or reach out to us. The COVID-19, I think, situation, clearly, just to summarize, I think this is something we are all following, either as professionals or individuals, on all kinds of media. It's been by far the most unprecedented event, of our lifetime, and clearly it's very different from the pandemics in the past, because of the globalization and the nature of connectivity that exists. The world is hit a lot faster and more, and both from an average hospitalization to the fact that there is a lot of stress on the healthcare infrastructure, to the not having a vaccine or a drug. We're all kind of left on a back foot. This has obviously also created a significantly large crisis from an economy point of view, from a jobs point of view. From the data, I think we have close to just in the aviation and related tourism industry, I think they're expecting anywhere between 25 to 30 million jobs to be lost globally. So these are big numbers, that we are kind of talking about, which is literally almost a mid-sized country in Europe, that's going to be out of work. So I think that is a massive challenge for all of us. Obviously, we are seeing some hope in some parts of the world, though it's very early days to see whether it's actually leading to a complete recovery, because there are fears of the virus coming back. But at least for now, the organizations and companies and governments in South Korea, Japan, China have been able to kind of adhere to some strict norms like the lockdown and the extensive testing and contact tracing, and we've been able to kind of at least flatten the curve, for now. We wanted to kind of bring you a dashboard from a India context point of view, which we believe is very, very critical. One of the things that we did do at this point, I think it is extremely critical for us to be able to understand what is happening on the ground. So from a Sattva point of view, what we did about 10-15 days ago, as soon as the news came out of lockdown and everything else, was to start to put data together in terms of what's happening in the country. And from an India perspective, we now we have a live dashboard that's on our platform, India Data Insights, which gives you all a very clear picture, both from government sources and also from some of the other sources, for us to kind of understand what the situation is. So here on this, and this is a live platform that everybody can access. So the number of total cases, to the ones that's been cured, and to the number of unfortunate deaths that we've had. The numbers are out there. We've been able to kind of map it out regionally as well. We're also kind of looking to bring in a lot more data as we go here. And one of the things we obviously also realize as a country today is that while the numbers look still at a lower end, I think we are not yet clearly doing the level of testing that we should be doing. So these numbers could kind of go up. So there is, I think, till that happens, we may not have a very clear picture about what the situation is, and hence a lot more stricter measures coming in. But at least what we are beginning to do at this point is to put this data out from a dashboard perspective uh, as clearly as possible. And also we want to use this dashboard to give everybody a sense of what exactly is happening across the country, not only from the actual healthcare numbers, but also where some of the initiatives are, where the requirements of the equipment are, where there is more need that is coming out from a government and the social impact ecosystem point of view. So we are looking to, right, in this presentation itself will give you more data, but this dashboard is, we're trying to make it as comprehensive as possible so that decision making on understanding what extent the challenge is and how you can respond, and where the needs are more by district, by state, can be kept out, so that we all can use much better data for decision making. And that's something that we will we will look to do. Obviously, from all the things that we are tracking, clearly there are some states which are more hit than the others, but at the same time, as we look at some of the healthcare data, we also kind of realize that some states are more vulnerable than the others as well. And as we kind of go along, we will look at a little bit of that data, as well. In terms of the impact, while the COVID-19 has not been in any way discriminating who it affects, I think the situation has very disproportionately impacted the more vulnerable sections at this point. A lot of unorganized sector, as we know, has been hit. There's now an estimate from the International Labour Organization that you must have seen in news today, that close to 400 million workers may be pushed more deeper into poverty, if this doesn't get better in the coming quarters. Also, this is impacted people who are in that range of extreme poverty much more. So I think that's definitely something that we should look to think about and see how we can respond to that. One of the things that I think has become a bigger crisis also has been from a social point of view. We are also seeing a lot more impact from a gender lens. Clearly, both because a large part of our workforce are going to be the Anganwadi workers, the ASHA workers, who are going to be our frontline. Two, we are beginning to also, get a lot more reports from the social sector ecosystem on some of the domestic abuse issues that have kind of come up. So the more vulnerable communities, the more vulnerable populations, all of them, are getting affected much more deeply. Even though from a COVID-19 point of view, it affects all ages and all classes equally. The impact has been much higher on these communities. And I think from an overall infrastructure itself, from an India point of view, I think our at an average, we have about 119 hospital beds per lakh people, which is significantly lower from than most of the other countries. which are already facing an extremely difficult situation, like the US or Italy. So we are fairly inadequate healthcare facilities, and I think that's somewhere again a lot of people have already started supporting, but it's important for us to understand where and how much is this gap. Our app has also kind of been, in terms of the last mile reach of the government to a lot less awareness in rural areas. These are also issues that we need to address. This slide gives you a much deeper idea about our current public health infrastructure, which is, I think, an important way to understand how much of a challenge we have, especially in terms of the disparity of the healthcare system in India. So this is also data that is now available on our data platform. So if you're working in particular states, we also have this data by district. And if you're interested in that data and you're working in any of those states or districts, and you want to have a good understanding of the healthcare infrastructure of those districts or states, do reach out to us. A lot of it, like I said, is already publicly available, but you will see that the infrastructure in states like Bihar, or in Uttar Pradesh, or even a Jharkhand, kind of a place, is significantly suffers from lack of both personnel and also the medical infrastructure, in terms of both the soft and the hard stuff. And that for us is going to be an absolutely difficult challenge to address, because we will be in many ways forced to kind of respond in the near term in some of these regions. As you saw from the data above, while Maharashtra has been and Tamil Nadu are states where things have been kind of going more. The cases have been going higher in terms of the current situation. MP has unfortunately very quickly caught up there as well, and from an infrastructure point of view, it's much less prepared, let's say, compared to some of the other southern or western states. So having that understanding of what amount of infrastructure or the type of infrastructure available in these states, in these districts, is critical for us to respond as professionals who are going to, in a strategic, structured way, work on this issue. We also now know very, very clearly that this is not a short-term issue. While there are today a lot of conversation about the impact of COVID. There are economists who are saying that this is something that is more of a shock recession. So there is a chance that it will be a very deep recession for a few quarters, and then it may bounce back. But at the same time, it's very hard today to estimate what will happen from a both economic and social lens. And I think some of the things that we are seeing is going to be affecting us, not just in the in the immediate term, but also significantly in the mid to long term as well. And we just want to give you a sense of what those impacts could be, and what we are seeing at this at this point. From a immediate impact point of view, obviously there's a huge health issue to access to food and essential services, the loss of wages that we are seeing, to a massive breakdown around the social structures from a migration point of view, and also the supply of these essentials kind of getting heavily disrupted. These are some of the immediate effects that we see, and I think this is something that we are all dealing with right at this point. But in the next 3-6 months, I think we're going to see a lot more, some of these issues getting a lot more multiplied, but newer issues kind of coming up. I think we are already very, very strongly talking about, mental health issues, and also increase in domestic violence. And today, from different corners, we still don't have actual data on it, but from many grassroots NGOs, we're beginning to get a lot of anecdotal evidence and input on how a lot of the cases of domestic violence have relapsed, and many cases are getting worse because now women are kind of staying more at home and are more vulnerable, at this point, given the current situation. And There's also, because of the reverse migration, the more need for resources in different parts of the country, and especially in rural areas, is going to kind of go up because people have gone up in very large numbers. So the impact in the near term or the midterm is going to be very, very critical to understand for us as well. From a long-term point of view, I think there, because of the job losses and the change in the way the models of some of these businesses will work, given that there is a chance that the potential of the virus coming back, some of the businesses may work very differently. Some of the jobs may be lost. And some of the migration may be difficult to kind of correct, which means they may not come back, which means there's going to be a lot more pressure on livelihoods. There'll be a lot more pressure on the gig economy, and the way the country will respond to a shock like this, which has put our unorganized sector at stress, is going to be very, very important to kind of understand. And from a healthcare point of view, I think our entire infrastructure, there's a serious chance of that getting crippled, which means how do we bounce back from a healthcare perspective, while at the same time we're going to live along with the risk of the pandemic coming back. So managing these things will become very, very critical. Also, I think some of the sector itself, and especially the non-profits, are very vulnerable. As you can imagine, this is not a sector that is run on financial needs. It's very much on from a public good point of view, which means very little access that non-profits have to capital when they're not doing work or work has shifted, and many other sectors like people delivering education, skill development, and other sectors are going to kind of be fairly hit with restricted movements, restricted resources. It's going to put a lot of pressure on some of the sectoral components of the social impact ecosystem, which then again poses a challenge for us, because without that ecosystem, it would be hard to deliver impact in this in this challenging time. Obviously, there's a lot of conversation around the impact of small and medium businesses. I think they will be again very vulnerable. How the government will respond to that? Lots of positive things that we are seeing, and Sattva, as we've been in touch with CII, FICCI, NASCOM, these kind of industry bodies, giving our inputs on what potential solutions could be and what expectations that different industries may have, that we should take back to the government and request support. So some of the things we are already beginning to hear, including, I think, as recently as yesterday, some discussion around income tax refunds and stuff. But I think the impact on sectors is going to be it's fairly cross-cutting. One thing, however, is I don't think it will be the same kind of impact on each of the sectors, both in the industry slash in the social impact space. So every organization will have to, while these are the principles, you will have to assess your exposure, and your community's exposure, your beneficiaries' exposure, and your stakeholders' exposure to this, and come to an understanding of what the impact is going to be on you and your stakeholders in the immediate term, in the short term, and in the mid to long term per se. But I think it's very clear that the post-COVID world is going to be a very, very different, kind of a world. From a Sattva's response point of view, we've been what we have done is we've put up an internal task force that's working very, very, I mean, literally round the clock and figuring out how do we work across all of these issues. Since we're in the middle of talking to many different stakeholders, we're in constant touch with the nonprofit ecosystem, so we have a sense of what's going on there. We've been very much clued into the CSR ecosystem, getting an understanding of what people thinking there and how they're responding. A lot of conversations have happened with the overall funder ecosystem, from the World Banks to the to different funding organizations in the country. Plus, we've been very closely talking to about 8 to 10 state governments, directly plugged into some of their conversations in their war rooms, to understand what the evolution has been, how the information is moving along, and what challenges these states are facing. From all of those things, what we have realized is, it is important for us to keep a few fundamental things, in play before, we respond to this. I think it is for us. The challenges are, first, there is a lot of disconnected initiatives. I think, like any crisis, the response has come in, the heart has come in very quickly. So people have responded with great amount of empathy, with great amount of want the feeling of wanting to help. And typically, in those situations, there's a possibility, to unfortunately play like the Lagan team, which means, we're all of us running behind the ball at the same time, and leaving the rest of the field open without addressing it. I think it's very important to coordinate effort. So there's a lot of disconnected initiatives that are kind of going on, at this point, and a lot more that needs to be kind of, managed. So we need to really make sure that we understand before we respond on what the issues are and where the need is, the highest, and if there's ways to kind of, collaborate on that. So that's one important, challenge. The second is that there's a lot of, coordination required in understanding, supply chains. I think one of the things we have to avoid is, the spirit of partnership has to be kept in place, because today, obviously, the requirement of certain, India has very few ventilators, not enough material on PPE, but it has to go to certain places faster than the other places, certain stakeholders faster than the others. So we as an ecosystem may have to prioritize some of these things, and there is going to be some level of friction also, because many different types of players are coming together, and this is all happening very, very quickly. And from that perspective, we need to be able to manage the friction that will come in, and that's where I think the leadership of all the organizations, all the initiatives, have to step up, to be able to, for us to kind of, manage this. I think it's also, critical for us, to ensure that we don't only look at the short-term view of relief. It's important for us to manage the relief activities, in a much more long-term kind of a view. While yes, it's very important to respond to the food that people need, the immediate requirement in terms of material from a healthcare perspective, but we also have to think about the fact that we don't have enough hospital beds. So a very interesting example of this is how the railways, and we've been talking to organizations and entrepreneurs who've been working with the railways for looking to convert entire coaches into hospitals. So also looking at it not just in terms of immediately what we need, but what we need day after tomorrow, in a week from now, 20 days from now, and a month or two from now, or even 6 months from now. I think we need to also potentially start to have that view. Otherwise, again, there's a challenge that we may send all the resources in in one particular direction. So what we have kind of really done at our end is we've basically looked at it from three different lenses. One, we want to play an extremely key role in putting the information together for this sector, for this particular response and initiative. So we are putting out this dashboard and also lots of other resources for India, where we want to make information available. So my request to all of you all is, please use the dashboard, but also contribute to the dashboard. If you know of initiatives, and we are only putting verified stuff, onto that dashboard, so that it's highly curated. So please help us in collating knowledge and information and data together, because that's going to be a very, very important tool for all of us to decide on how do we respond and what we need to do at this point. The second thing is we're playing a very important role in being an orchestrator. We are, in some sense, have a little bit of an advantage of being in the middle of many stakeholders. Like I said, we've been talking to a lot of nonprofits and social enterprises who can contribute at the ground level, who can come up with new equipment. We're talking to people who have supply of these equipment. All of those things, we are building our network and database. At the same time, we are also on the other side, in conversation with a lot of the funders, both private and corporate, and also engaging extremely strongly with the government. So we are in the middle of orchestrating a lot of solutions, where it's important for us to make sure that actually outcomes get delivered, and we are able to move material, move resources, move solutions in the direction of its need. So a strong role of orchestration is something that we've started to do. We've also had a lot of success in that, at this point, as we've been doing this over the last few weeks. From a solutioning point of view, we also realize that this is something that is not going to be only existing solutions. We need to rethink and come up with new solutions. You've already seen some funds being announced on that particular thing, but I think it's very important to look at new solutions as well. The livelihood models, and you've seen education models change. With now most of schools and colleges getting closed, you will have to move to more online based stuff. You will have to relook at new solutions in terms of how we will deal with so many migrants back in the villages. What will the impact be on agriculture? What will be the impact on water, in some of these regions? So a lot of innovative solutions are required. So rebuilding for that and rethinking some of the solutions is something we put up a dedicated team on that. So from providing information and data, supporting different initiatives on the ground immediately through orchestration, to coming up with new solutions. These are the three key things that we are kind of doing, and that's something that we will look to do. I mean, I'm just also gonna as we speak, jump into a couple of questions that's come in here in terms of to Andrew's question of how does the Supreme Court on free testing impact the dynamics of manufacturing kits, while it is required. I think this is definitely a challenge, and we very recently this is definitely going to put a lot of pressure on the supply chain, and very, very recently, I think what we were discussing is, in one of the conversations with a medical device manufacturer, there was a massive challenge of working capital. While they had all the stuff to manufacture ventilators, working capital was a huge issue, and already it's already a clogged supply chain, and if the Supreme Court the recommendation actually gets into execution, then this will probably drain out the resources even more. In the short term, I don't know what the eventually the court and the government will decide, but in the short term, wherever we have found this issue of the resources being drained out, in a few cases we've been able to organize CSR funding to release the working capital requirements of some of these players. And I'm happy to share in more detail how that was done and what we were able to achieve. But I think we may have to figure out a more equitable model without taking the money off the supply chains, for these tests and other resources required. We may have to figure out, a model of either an Arvind Eye Care or some, or the reimbursement model of the Yashaswini healthcare system in Karnataka, where the private and the government work together to make sure that whoever can pay, and whoever can't can be taken care of. But draining of the resources from this ecosystem will be a very big challenge for all of us. In terms of, just want to move on in terms of the next few slides of showing the data for you all in terms of what we said. Clearly, we're putting out a lot more information in line with what I had just discussed. We You will see on our dashboard very clearly, both in terms of how many efforts are going on at this point by state and who's doing what, and it's an interactive dashboard. You will also be able to quickly map out the needs, exactly, where, how many cases are there, what the needs are in terms of the gaps of the healthcare infrastructure, what already existing initiatives are happening, and hence what you need to do. All of this is now available, as you can see in slides 10 and 11. All of this is available now on our platform, and I want to make sure that we deliver that to you all on a regular basis. Plus, at the same time, we want to make sure that more and more data comes here, so that we could make this very rich in terms of as a decision making tool. So my request is, please continue to push more information and data here. I know there's lots of questions around the new, changes to the CSR law. I think I'll just hold on to that for a minute and come back to it towards the end. But I think it's something that may not happen in the immediate term, especially because PM Cares, we understand, has been set up as a charitable trust, and many people are putting in money there. So I think we have some respite there, but we'll see. We'll come back to that in a little more, detail shortly. Moving on to just from an orchestration point of view, while I showed you a lot of the data part, from an orchestration point of view, some examples. We've already had a lot of success working with both Karuna Trust, and Pernod Ricard and many other partners. I'm just giving some examples. We've been able to mobilize quite a few resources to Ladakh, for example. We were in touch with the MP at Ladakh, and they were struggling, and we were able to quickly orchestrate both the supply and funding, from Pernod Ricard, to be able to meet the supply needs. Similarly, across different states, with partners like Naranayalaya, to Karuna Trust, to SVYM, to many others, we've been orchestrating solutions at this point. And we definitely believe that this kind of an orchestration can help meet the needs very quickly.
So you can use it now. You don't need to do anything.
Ramasan, you may have to be on mute, Ramasan.
Okay.
So I think that is some of the examples of the orchestration that we've been doing. And again, I know a lot of you here already on this call, have been in touch with us, and thanks for all the wonderful work that you are doing, and whatever we can do to help and orchestrate more solutions and more things to go on the ground, we'd be happy to do that. And like I said, our team is working literally around the clock, to make it happen. In terms of the way we are, putting these things, together, we realize that, from a CSR perspective, especially working in this scenario, requires a serious amount of agility, and it's not at all easy to deliver that level of agility. Things are changing every day, and we've also, from our experience of CSRs, it takes time to actually make some of these decisions and move through the process and actually release the funding. So we've been, what we are doing from our side is, in many places, putting together a well packaged need, so that decision making time can be cut short significantly, and we've had a lot of success of that. in the last 2-3 weeks. We've also started providing a lot more direct support to CSR committees and boards. We've been in calls and meetings on a regular basis to make sure that the understanding of the solutions are there, and it's very crisp and clear in terms of what the impact can be. We've also very quickly put out an extremely lean, and extremely cost-effective, partner due diligence and onboarding approach, and a very lean program management monitoring approach. Because at the end of the day, we cannot, just because we are in a little bit of a, I would say, a crisis situation. That doesn't mean that we in many ways don't follow the fundamental principles of impact. So we still have to design well, we still have to think through that, because the systemic problem as well. Sometimes there's an immediate need, sometimes you're looking at things which is a little more structured. So the program design is critical, and it has to be monitored, because at the end of the day, it's not about putting the money onto the program but making sure that the outcome is achieved. So we still have to do that, but we do not have time. We have much little time and resources. So we are figuring out how all of this can be done in an extremely lean fashion, from partner due diligence to program management to monitoring, so that this can kind of come through. We're also on a constant basis in touch with the social organizations on the ground, to deliver these solutions in as innovative ways as possible, and as resource effective ways as possible, because we need to get the reach out there to many of these places. For example, a lot of the grassroots organizations are helping support the health workers on the ground with the personal protective equipment to awareness in communities. I think we've been seeing, especially in states like Mizoram, the grassroots organizations have done a phenomenal job of actually building capacity of the community organizations and the communities to follow these measures that have come out from the government. So thinking through some of these things, making those innovations quickly available for everybody else in our network, and working with that ecosystem, again, that's something that we are doing, so that everybody benefits here. And of course, like I said, tracking the outcome and managing it from a compliance point of view is another very, very critical thing for us at this point. From an effort point of view, we realize that there will be in the immediate, there are a lot of you who are already funding immediate efforts in healthcare, and that's very much required. Improving the bandwidth of healthcare in India is going to be the number one priority. From whatever we saw from the healthcare data, we are today far behind a UK or a Japan or an Italy when it comes to healthcare infrastructure. So the only way India can get out of this is to prevent this, and not get into the situation at all, but prevent it, and that will require a serious amount of focus on personal protective equipment, testing kits, and all of these things, which is very, very important to make sure is available in every corner of the country. So that immediate healthcare focus is something we've done, and a lot of you have supported it, so thanks for that, and a lot more are kind of coming on board to make that happen. There's also a lot of immediate requirement from a non-healthcare perspective. Obviously, availability, the food security, and the food to a lot of the vulnerable communities has been important, but also livelihoods kind of being taken away, just in terms of complementing the government from a from all the things that they're doing, in terms of cash transfer, to making different things available to these communities, from food to resources to education to many other things we need to kind of ensure. And that's something, again, many organizations are doing. There are many donors, who also directed a lot of their work into this ecosystem, and working on extremely immediate initiatives. At least two of the large family offices and family foundations in the country that we know of have put all their efforts, completely entire operational energy into resolving these immediate healthcare and non-healthcare needs, across both the Premji's initiatives and foundations, and Piramal Foundation. So if at all you need any support, or you want to connect with any of those people, then we'd be very happy to enable some of those partnerships as well. In the nearer term, we are beginning to, start putting solutions together. It's still a little bit of early days while we are all guessing what the impact is going to be, and while some of those is becoming obvious, we still need more better solutions. And each of those, each of the micro ecosystems will need different solutions. So, to give you an example, the fact that many migrants have gone back, and especially from the craft clusters or handloom clusters, the intervention there will have to be very, very different from what we will do with, let's say, in more agri-based clusters or some other clusters in the country. And from that perspective, we will have to come up with new solutions. So in the near term, we are more, I would say, at the ideation stage, whereas in the immediate, effort in healthcare and non-healthcare, we've actually gone on the ground already very, very quickly, and a lot of stuff is happening, in that space. I think. What we will also see is, because of this, a lot more partnerships coming through. I want to share example of one collaborative partnership that has been put together, called the India Relief or India COVID-19 Fund. A lot of us have jumped in, with support from AT Chandra to many other funders. Give India, Facebook, CSIP, Dasra, Sattva, we all have got together to see if we can do a collaborative fund which can actually address some of the more immediate and near-term impact, solutions. While we are working on many such initiatives, this is just an example I want to share on how a collaborative model could work. We already are seeing some early donors kind of come in and join the bandwagon, and see, both from a retail perspective and from a retail giving perspective to institutional giving, how we can bring those partnerships together, and also make sure that we deliver the value to the country in the most needed areas. So this is an example of a fund that has kind of put together, and this is really, for me, this talks about both the strength of partnership and also how quickly we've been able to do that. And while everybody in the ecosystem are friends and we work with them, we've always been in touch with a Give India or a DASA or a CSIP, but it literally took us less than 48 hours to 72 hours to put this whole group together and say we will partner. And I think that's what is required at this point, to build those partnerships so that we can combine forces and play to each other's strengths, and bring more collaboratives, kind of approaches. This, like I said, this is just one of the examples. There's similarly a fantastic initiative that I'm sure all of you are tracking with, called the ACT, the ACT, which has been put together by most of the venture capital and private equity firms in the country, from Matrix Partners to Axel to Sequoia, and many others. They are focusing a lot on immediate healthcare innovations that can be significantly scaled up. They've already made a few investments, and they're now looking to strengthen that very much as well. So all of these are wonderful collaborative initiatives, which I think we should all leverage, contribute to, and see how this can be scaled up. And this also probably gives us the opportunity to partner, because we have a very strong common mission, at this point. I'm sure there's a lot of questions when it comes to CSR, at this point, in terms of where do you contribute, how do you contribute, do you work with your own current partners, or do you find new partners, what is the effort required in making all of this happen, should you contribute to PM Cares Fund or not, and many such questions. So we wanted to kind of go through, like I said, some of the more common questions. We picked about close to 20-25 questions that out of the 100 plus that came up, and some of them were common questions. We will try and walk through some of those today and right now. And like I said, whatever we cannot cover, we will definitely try and address them as as soon as we can. Um, what we are, in some sense, recommending to people is to very quickly get a sense of your boundary conditions. For you to answer these questions, I think getting a good sense of your boundary conditions is very important. So we need to very quickly know what resources we have and what timeline are we looking at, and what has been our thought process around responding to this particular initiative, and what criteria do we want to kind of put in terms of geography, the type of issue, healthcare, non-healthcare, midterm, short term, near term. Answer some of those questions to actually figure out where we should kind of play. Once you have both in terms of whether you want to play now, here, or in the short to mid term, what resources, how much resources you want to kind of put in, plus what kind of effort you want to deal with, which should also be very much linked to your strengths and your already existing thought process in CSR. And please use our dashboard, and if some data is not available in the dashboard, reach out to us, but please use data for this decision making to say where do you want to contribute, and in what form do you want to contribute. Once you have that, I think then the third step of finalizing your partner, you could for some many of the large CSRs, you could just ask your current partner to adapt and respond to some of these situations. You can bring in new partners, and in many cases we're seeing funders also permitting their existing partners to evolve the programs to be a lot more responsive to COVID-19. And suddenly we've seen community organizations transform into a little more awareness building and healthcare focused organizations, and many of that has started to happen. So either work with existing partners or bring in new partners, or adapt your program that you already do to solve some of these issues. But that's a good way to do it, and doing it fast is very, very critical. I think the speed here is going to be important. We've been very, very inspired to see many CSR committee meetings happen literally with the notice of less than 24-48 hours and taking decisions. We have never obviously got decisions at this pace before, but everybody is now responding. And what used to take 3 months, 6 months for decision making is now happening in less than a week. Kudos to everyone in the CSR ecosystem for making that happen. It's just amazing to see the level of decision making and the agility that's been brought in. And along with that, streamlining disbursement and doing it very, very quickly is will enable us to move the money and the resources as soon as possible to the most important requirement that we may have decided on. And obviously our efforts is as corporates is way beyond just the money. So I think what we bring in terms of our understanding, manufacturing, we know some of our customers have already started to even think about manufacturing ventilators, and I think they're beginning to put their supply chain around it. There are many others who are moving to build other PPE equipment. So you can contribute way beyond just money. A lot of requests have come to us from employee volunteering and virtual volunteering. We've been directing organizations and sending them to different places where they could contribute to government, to social enterprises, to variety of other places, where either their technical skills or their general management skills can be used. So think as much beyond money as possible, because I think this will take a lot more than just a few checks to solve the problem. We'll all have to put our networks, our intellect, and our heads into hand to be able to deliver this very, very effectively. Whatever we do, obviously we have to be extremely compliant from a law perspective. So ensuring compliance is very important. So we are constantly in touch with people in the Ministry of Corporate Affairs on how we could get some of the questions answered in terms of from a COVID-19 situation point of view. But ensuring compliance is super critical. While the COVID-19 has become it's possible to now book it under that, and it's also healthcare, a disaster crisis, and you may be also spending on livelihood. So all of those are already covered. So from an issue point of view, there's no problem, because the Schedule 7 takes care of it. The PM Cares fund is also something that's available, and it can be built out as one of the tools for CSR. I think it's an important decision on whether you contribute or directly or through the PM Cares Fund. We've been in touch with people who are also talking to the PMO and other government machinery. I think the plan is yet to come out very clearly on what will happen, how it will get spent. I think in the next few days we are expecting more clarity there. But at this point, that's something that we've not yet had, but it is going to be a key important place. There's also the CM funds that have come up. We haven't, while the PM cares, we have now clear guidance that it will be part of CSR and there is compliance there. We are yet to get clarity on whether that applies to the CM's fund as well. I think it's just a matter of time it will be applicable, because we've seen that happen in many other disaster situations where the CM's fund becomes compliant. So in all probability it will happen, but we are just waiting to get more clarity on that as we go. Like we said, we need to bring in more data for decision making, and also go beyond funding, plus make sure that our current projects also don't suffer. How do you prioritize? I think there's going to be a little bit of a dharam sankat in terms of whether you continue your current projects, how much will you direct into COVID-19. I think these are going to be very difficult decisions on what you pull the plug on and where you will go. Our request is to keep many factors in mind, including how potentially some of these organizations that your current projects are dependent on can actually evolve. And if there's a way you can marry your COVID-19 work with your current ecosystem, that's probably the best answer. But it's not going to be possible in every case, not easy in every case. So wherever, if you need help, we are very happy to jump in and support. But keep an eye out on on your current projects as well, in terms of how or what decisions you will take in terms of a COVID-19, from that perspective. Before I go into the questions, just to summarize, I think the COVID-19 clearly is by far the most difficult crisis we all have dealt with in our lifetime, and it will have a long-term impact, particularly on vulnerable communities across livelihood, healthcare, the social development, which could include education and skilling and many others. That the current situation in India is on a rise. The only way to deal with this in India, given the fact that our healthcare ecosystem is not very strong, is to prevent it at any cost, rather than get into the situation that some of the other countries have gotten in. And there, the civil society has an extremely high role to play. Though India's healthcare ecosystem is still evolving, I think we have one of the most active civil societies in the world. I don't think in too many places so many different stakeholders have jumped in to deal with this issue. I'm sure in some of the other countries it's been either the government or the police or the healthcare and the military who really got involved, whereas in India it's been the entire civil society ecosystem. So we should work together to be able to manage it in a way that we prevent it, rather than take it to an escalation point. While relief is the need of the hour, I think, like we said, there's a lot of immediate requirement, but there is also a lot of need to think about the mid to long term. So having that view is super critical. I think it's important to make CSR decisions for funding using data, proper due diligence, clear monitoring, and in a very strategic, systematic kind of a way. And hence taking probably a little more portfolio approach on what you will do, some immediate relief equipment kind of stuff, something more strategic and system led, and something that can be a little more in the near term. I think allocating your resources in that form may help. And figuring out that how we stay compliant, because there will be need for many innovative solutions, but ensuring compliance will be something that we will have to do in these times. And from a CSR perspective, while solutions are very, very important, so is compliance. There's a lot of discussion already with it was very, I would say, interestingly timed, where the new changes to the law were also proposed around a time that I think the country was going into crisis. So while there are many things up in the air, I think we have to follow a little bit of a conviction and show the leadership by engaging with the government and the Ministry of Corporate Affairs on what changes can be possible, and work on that together. But compliance is going to be at the at the core of everything that we all should do, so that along with the solutions we deliver, we also take care of that. Just now jumping into some of the questions, we picked it up, like we said, from a lot of you who've asked these things. We will try and address as many things as possible, but let me, given the many questions came around the trust and the society and the Section 8, I think today it is fortunately it's not yet the law, and I think there's been a massive amount of pushback everywhere. I mean, we ourselves have put out our recommendations to that, and every part of the ecosystem, I think, has unanimously gone back and given the feedback that it's not possible to run either the CSR or the social impact ecosystem without 80-90% of the ecosystem, which is the trust and societies. So I think, given and also the fact that there's so much of work that is being done by these organizations on the ground in this time of crisis, I think that will be relooked at and reviewed very, very deeply. But yes, it's unfortunately a point that's been put for discussion, and I think we will have to live through it to see how how the government will respond to that. And the fact, like I said, on a more lighter note, that the PM Cares Fund itself is set up as a public charitable trust with a whole bunch of advisors and everything, it would be a little bit counterproductive to take that off at this point. So my sense is, at least in the immediate term, the possibility of, trust and societies getting out of CSR is probably low. I could be wrong, but I'm right now probably predicting that it won't happen, at least in the, in the mid to short to mid term. Getting into the questions now, in terms of, I'm just going to go through the first few questions. In times of disaster or health crisis, how can we build a common and unified contribution to a specific blueprint for managing the disaster? I think we all are, and that's why we put out the data very, very strongly. We wanted to kind of ensure common understanding of the issue so that it can happen. Some of these collaboratives, I think the blueprint can only come from, somebody like the government in terms of working across, and it probably will change by sector, by region, but a larger understanding has to come from there. But I think what we will see is mini blueprints come up. I think there is, like I said, the craft sector has come together to put out a blueprint. The livelihood ecosystem of 20 NGOs has come together to put out a livelihood blueprint. I'm sure similarly the edtech and the education ecosystem is going to get together and put out some blueprint. There's an opportunity for CSRs to come together and say, hey, what would be the approach that CSRs may take? There will be some of these mini blueprints, and then partnerships that will happen, which may have to be then tied together at a more macro level. But moving in that direction is clearly the I would say at this point the the need of the hour. In terms of how do we establish facts from friction, because there's also a lot of data and information out there. Again, this has been a big challenge, as you can probably see. Every part of media is giving you different numbers. So I think what the principle that we have followed at Sattva and we continue to follow is we will only look at government data, and I think that's probably the source of truth that we should kind of go to, and rely on that, however good bad it is. But it's something that we should probably use as our a key source of reference. And on the second thing, what we are doing is to make sure that anything that we publish is clearly validated, verified, and curated. Otherwise, we would rather give lesser, more verified data than a lot of data which is not verified, and that's the principle we are following. So if you hence use our dashboard, I think you will most probably get as close to facts as possible than fiction. So that's something that we should do. But I think we also will have to make judgment with limited resources. So some data or whatever data is available, we may have to use that to make decision, and that will be a little bit in some sense taking a bit of a leap of faith or using our experience and instinct to make some of these decisions. um, there's a lot of support for immediate relief. Are we thinking enough long term? Like I said, yes, there are many initiatives that have started working on it. This example of the craft cradle that's been created by a whole bunch of social enterprises, incubators, funders, is an example of that. There's also already, like I said, a lot of thinking happening around livelihoods itself. So, how livelihoods is going to change, how education is going to change. So if the question is the whole ecosystem thinking long term enough, the answer is probably no, and I think we have to be honest about it. But I think we are beginning to start to think in that direction, but there's also very heavy need for immediate relief. So balancing that is going to be critical, and it depends on what constraints you have at your end, and what resources that will also probably determine that. There are companies who can share products. I think this is a question that comes along quite often. I think a lot of companies are looking to potentially give away products. I think this is a bit of a gray area. I think how you price the product, what you account for, what your auditor says about it, all of these matter. So it's not a clear black and white. We have seen examples of where the products have been extremely useful, and very structured, systematic way companies have been able to book it under CSR. But in cases where it's not possible at all, given there were challenges of whether the product was relevant, how much of the price they were actually booking, all of those things became contentious, and and there was some discrepancy between the auditor and the team itself. And then when we went back to the MCA for some guidance, we got answer saying this may not be possible. So I think it depends a little bit on a case to case basis. We have actually set up a bit of an internal team that's answering only compliance questions. So do write to us if you have a very specific ask on that, giving example of what your product is, where and how, in what context, and we can get back to you with a quick answer on whether it's possible or not. I think is there a database of various nodal agencies coordinating COVID-19 efforts? I don't think there is at this point. I think again we are trying to build as much of that as possible. You will probably see that in our dashboard very soon. Some part of it is already available. But again, if you have more specific questions, do reach out to us, and we can we can make that happen. Um I'm just also picking up quickly on the chat. Andrew's question on can Sattva help curate and deliver courses for work from home professionals around a professional management of CSR within corporates? Absolutely, Andrew. I think that's very, very possible, and we will very quickly come back to you on how we could potentially do that, and with some thoughts on that. I think it's a great idea, as well, for all of us to think about. So please give us a few days, and we will come back with suggestions on how we can curate and deliver these courses. In terms of what are the reports from the ground level on end user funds, I think it is possible, in terms of um, very much through monitoring mechanisms, the use of funds, and from the ground, we were able to get a lot of evidence. Though, I think the only thing, because this is something we've been doing for a long time at Sattva, the only thing we're not able to do is physically go there and validate. But everything else in the last 2 weeks that we have delivered on the ground, we're able to get a lot of, reports, photographs, feedback, talk to stakeholders. All of those has been possible and validated from the ground. So it is possible to get those. I think the only thing that's going to restrict us from doing this will be to to actually be able to go on the ground at this point. In terms of how the donors can come together as a consortium, like I said, we've already had the India COVID Fund with Give India CSIP, Dasra, and everybody else. So if you are, in some ways, interested in being part of that consortium, please reach out to us and see how we can work together. We could also, look at creating more, I would say, specific consortiums. Like, for example, if some of the BFSI teams want to get together, if some of the tech guys want to get together, and or get together for regional partnerships, all of those are possible. So do reach out to us, and we can tell you what all is already happening. You will see that on our dashboards as well, but we can also connect you with some of these people, or help create some of these partnerships, for you all. I think there will be, in terms of the next question of immediate interventions post the lockdown, I think there is going to be a massive focus on health and hygiene. There's no question about it, because that's going to be a big determinant of whether this will relapse or whether we'll get out of it in with little damage. So we are expecting a huge focus on, on wash and health, related activities. And I think, it's going to be a lot of behavior change to be done, from a social distancing point of view. India is probably one of the hardest countries to practice social distancing. We're very community led. We're always surrounded by people everywhere. So, we need to be able to bring in a lot more behavior change, and grassroots organizations probably very well positioned to do that. We will see a lot more impact on livelihoods, and many interventions on livelihood come up. Like I said, many are already in the works, but I think it's still early days on what those interventions are. But I think we should all keep thinking about it. And from the ground, we are already seeing some exciting stuff. I'm sure you guys are tracking a very interesting partnership that has emerged between Gram Vikas and ESAF and a couple of other partners on the ground in Kerala and everywhere. They've created a Bandhu, helpline for migrant workers. We're getting a lot of data from there that's, giving us some of the insights that we are sharing with you, be it on livelihood, be it on domestic violence and other things, and the need for equipment and healthcare and hygiene initiatives. You also probably will see, another places, from somebody like Piramal Swasthya, which is in the telemedicine space. We're seeing an absolutely strong, focus that's coming in terms of how the calls have gone up for them, what the questions are coming in those calls. So bringing very strong analytics onto that is also giving a much better sense of what's happening on the ground. So there is enough forums to get that data. If you know what specific data from the ground you're asking for, let us know, and we will, again, very happy to support you there. NGOs have to work together. There's no question now. Partnerships are super critical. And I think it's wonderful to see, 20 NGOs come together on the livelihood space very quickly, right after. I mean, again, it took them 24 hours to put that piece together. And when the whole migrant issue came up to the fore, they really responded extremely fast, and kind of made that happen. Again, on the crafts thing, it's a partnership between 3 social enterprises, and then Sattva has now jumped in with a few other funders coming on board. So we're seeing some wonderful partnerships emerge. As you can see already, Dasra, Give India, Sattva, we're all again sitting and putting a collaborative fund together. So some of these things will become the norm, as we go, because I think the problems we are now fighting are much larger than what each one of us can do, for our own selves. I think the new learnings and innovations at this time is to, I don't think there's one straight answer, but from the perspective of being data driven, being solution oriented, and thinking little more leapfrog, I think we'll have to, completely break the current models and rebuild the new models, and that will take some leadership and courage. I think that's going to be the harder thing to do. And we recently heard from a very interesting quote that it's when you're going through a tough turn, it's important to keep the focus on the road and not the wall in front of you. I think we need to figure out how those solutions can come in and what kind of a culture we'll build, in terms of bringing those solutions within Sattva itself. As the head of the organization, I've been amazed by how many new ideas people have come up with within Sattva in the last 1 to 2 weeks, and it's just fascinating to see how people want to contribute and how we all could potentially work through this. Taking a couple of questions. You know from the chat. Mental health is going to be a very, very important part of work. You will see that to be a focus. It's part of the ACT fund as well, the ACT fund. The VCs have put together. Mental health is a focus. Many organizations have put that out. We ourselves at Sattva are taking that very seriously, both internally and to our stakeholders. So you will see that to be a very big part of the efforts. We can send you. We've collated a list of all organizations working on it and initiatives. Again, you will see that on our dashboard very clearly. We're happy to share that with you. And very simple to reach out to us. impact@sattva.co.in is our ID. So do write to us, or anybody on this forum. You should be able to write to us, and we would very, very quickly come back with those resources as well. And whatever, Samya, we can take your support on, we would be very happy to do that. Moving on to the next set of questions. How the COVID crisis is likely to have an impact on the social sector. The primary beneficiaries, who are mostly children, young men and women. I think it's going to be a very, very difficult time for the social sector in many different ways. I think the resources are being crippled for the organizations working on in this space, and at the same time, the beneficiaries, quote unquote, have been put under a lot of stress. So you're now looking at a system where whoever we were working for are at more stress, and whoever was working for them has less resources. And I think that's going to be a difficult thing, because also there's going to be a lot of money going into healthcare and immediate stuff. How do we bring more resources from other parts to be able to manage this? Because it's not just going to be some philanthropic capital. We'll have to bring in resources from many different places to solve these problems. I think it's going to be a very testing time for the social sector, and we are also the people who are really, I would say, also at the forefront of this, along with all the healthcare and other professionals. So we will have to kind of step up and be innovative to come out of these challenges. But this is going to be a challenging time. Will this situation bring any change in terms of implementing the regular CSR project? Absolutely. Education. If schools are closed, education programs are not going to run. How long the schools will be closed, what will happen later is hard to say. So I think you will see probably a more and more blended approach coming. I think we recently heard that the Delhi government has already partnered with Unacademy to bring most of their schools online. So you'll probably see that. So there will be disruption in education and many other sectors, but regular CSR projects will take some impact. One of the things at Sattva we have started to put together is a simple diagnostic tool using all this data that we have on what can be the impact on your CSR portfolio, which we can come and tell you in a very quick, simple fashion, and based on that create mitigation plans both at your end and your partner's end. So this is something that we have put together at Sattva, and working with some of our customers on. So we'd be again very happy to share and discuss that to minimize the impact of your current programs, or how do we pivot them to contribute to COVID-19. Taking a couple of questions again from the chat. Today it seems like everybody's focused on immediate relief. What are the plans for the future needs? Education, healthcare, are there concrete initiatives? I think there's a question on what will happen in the future from a needs point of view, and will digital play a key role? I think we have a very strong feeling that technology is going to play a key role. We've all been wanting to digitally transform, especially the social sector, and it's literally happened overnight now. Everybody is now working online or coming in, doing all kinds of activities remotely. So I think technology and digital will be an extremely key, component. And again, that's where a lot of the work that can happen by corporates in enabling the digital and especially the technology ecosystem can be of great use, for this particular, sector. Um, Coming back to questions, onto the slides. What is the recommended corporation strategy to combat the current situation and phased interventions rather than just donations being announced? I think it's important, like I said, to have a portfolio. It's not important to just going and jumping to action. We need to plan, have a, like I said, a systemic and a strategic view. Divide your portfolio, spend something now, watch the game, spend something little later, and build it up. I don't think we should be reacting, we should be responding, which means we have to think through our approach in a little more structured, phased manner. I think that will be very critical. I think it's important for corporates to also share. In a not in a way that it's unethical, but in a more regular way. I think it's extremely critical for corporates to share what they're doing in this space. I don't know if it's for brand building, but I think the biggest advantage of it is that it's very inspiring, and two, it enables other corporates to to also kind of step up and contribute equally. So I think as an ecosystem, we need to tell the stories of success, both from the ground, from different stakeholders, government to corporates to everybody. So if you're doing something great, please tell the rest of the ecosystem. I think we all would love to learn from what you're doing at your corporate level. Um, at this point, what is the biggest need in terms of equipment, daily provisions, PP, etc., and in which state? If you go to our dashboard, you will see that entire data, very, very quickly. The allocation of funds in PM cares and CM relief, like I said, is not yet happening. We've been in touch with those forums and the PMO and everywhere else. And what we see at this, at this point, is that we will we will be able to track and figure out what the plans are, because both of them are putting up different advisory committees. I'm hoping that in a week or two we'll have more clarity on what the two funds or different funds will do from a government point of view. At this point, it's still, I'll say, work in progress. I'm just also right now told by our team that some of the data is still getting updated on our dashboard, especially from a equipment point of view. We've built a very, very large set of supplier base and other things. So if you have any questions and you want to contribute at an equipment level, at a PP level, do get in touch with us, and we will give you more specific data and information as well. Will the contribution to CM Relief Fund be under CSR? Not yet. Like I said, it's not yet clear. We are expecting it will surely happen. But has it happened now right away? I don't think so yet. We don't have that announcement, so we will keep you posted if that kind of comes through. For supply of medical equipment and PPEs, how do you want to assure quality of product? I think today it's very hard. I mean, we should go with some checks and balances. So we are doing a lot of due diligence ourselves. So please use our due diligence templates if possible, and see how you can make sure that there's that checked and verification done on both quality and in terms of how the pricing is done. We're able to give you benchmarks on all of those things. Plus, I think we should also rely on each other's network. Today, for example, we know a very large Indian foundation is making grants fast pace. They are not able to do the depth of due diligence they typically do for 3 months every time they give a grant. So they're relying a lot on network, so they're making calls to people like us and checking with us, saying, hey, do you know this? Do you know this person? Do you know this organization? And you vouch for them. And if people say yes, then you're going ahead with that. I think we will have to use a combination of these things to be able to make those decisions on quality and and everything else. I'll quickly take a couple of more questions from the group. I mean, the chat that's coming. What are the few steps to be taken at community and government scales to address the same? Where can CSR kind of come in? I think the question was more around urban resilience in general. I think again, lots of the CSRs and
Hello?
healthcare ecosystems are working on that, and we're seeing more and more companies potentially
Hello?
contributing to that. So we will We will look to contribute to building urban resilience, both from a healthcare perspective and also, some of the livelihoods and other areas. And definitely CSRs can come in and support there. How should non-profits realign their expectations from CSR for this financial year from a funding perspective? What are the two things that CSR should prioritize for this year? I think non-profits, there's a lot to do on what you could do. We are having a similar webinar next week on how non-profits should manage their work and how they should pivot and think about enabling more response to COVID-19. So please, do join there. But I think you should go back to, if you're a non-profit engaging with the CSR, you should go back to your funders and have a clear conversation and co-create a solution on together working on COVID-19. And I think having that conversation, and we're seeing that happen already with many corporates and CSRs, and I think that's something you should do. The two priorities that I would say, from a CSR perspective this year would be to make sure you have a strategic, clear, data-driven response to COVID-19, and at the same time, you continue to take care of at least a good part of your current ecosystem of funds and programs that you already have, so that the more fundamental needs that you're focusing on doesn't, get completely hampered. So balancing these two will be your key priority, and making sure in both places you're taking a data-driven systemic approach. I think will be important. Can COVID-19 donations get offset in subsequent years CSR spend? Absolutely yes, because most of it is either in healthcare or in disaster or in anything like that. So from that perspective, my sense is it will be possible to do it because it already in many ways was part of the story of CSR already. I think there was another question around why doesn't CSR companies recruit students from social science institutions and mostly have people already working in related organizations. I think it's possible. There's a lot of talent out there. If there are specific ways we can help, we'd be very happy to do that. Given the paucity of time, I'm just gonna probably take another 5 minutes to answer a few more questions. Like I said, we will come back and help answer some of these big ones to all of you over email very soon. What should we do to continue providing support to the needy since everybody has budget limitations? Will government help? Yes, lots of programs happening in every boardroom and every government conversations. We see that this is a big part of their thought process. So definitely there will be things that the government will do. I believe there's a time where we should work as one. Corporate collaboration, I think we've already talked about it. Sattva is extremely happy to connect, and we will definitely be keen to make sure that some of these collaborations can happen. We'll now go to the last set of questions. Which of the two options is more effective? Lump sum donation to PM cares, or doing it in our own in bits and pieces? I think I don't think there's one answer. It depends on who you are and what you would like to do. There are pros and cons of both. I think you should think through, if you have the ability to contribute in a strategic manner on the ground with your stakeholders, then doing it on your own is much better. But if you believe you don't have those resources at your end, you don't have the time, you don't have the resources, then going through PM Cares kind of an approach may be better suitable. So and obviously a lot of the PSUs are going in that direction, given that they have some engagement from a government point of view that requires them to do that. So depending on who you are and what your thought process is, you may be able to do it differently. I think the next question is definitely interesting in terms of in the retail space. I think this is again where a collaboration is possible. So if you are interested in putting together a collaborative platform for retail fraternity, please contact us. We work with a lot of retail companies. We'll be very happy to see how that can be done. Yes, in terms of one-time donation, for PP supply and food supply can be considered. We need to kind of again keep the compliance norms in place, structure it as a project, and clearly measure the outcomes. I think that's very critical. We still don't know how the government is going to use it, like we discussed, and what those gaps are. I think as we know more, we'll come back. But the current gaps are available on our dashboard, and you'll also know what's going on in different parts, so you can use that at this point. I think there are questions around tax exemptions. Given that there's some changes, this is something that we are validating and verifying with the ministries. We will come back to you on that in a little more better way. We've built very effective monitoring tools, for this scenario. We've reworked our due diligence and monitoring approaches in the last 2 weeks to suit this current CSR scenario. I think you have to base a lot on evidence and monitoring through conversations in each of these places. So we should be able to manage that through much more rigorous monitoring in a very evidence data-based approach rather than just doing it in a subjective fashion. If you're interested in looking at our tools, we'd be again very happy to share them with you to do, get in touch. There are no new guidelines and yet way forward for rebuilding the situation after COVID-19. I think we will at this point, like I said, taking a long-term approach is critical as CSR, and we should be able to do that as an ecosystem, and keep in mind that this is a very multi-dimensional problem which is going to affect us in the years to come, and probably definitely in the months to come. So we need to take that long-term approach. And depending on what your CSR focus is, the way forward can be, put together, depending on what your focus is, whether it's on, livelihoods or education or healthcare. I think the system will be very different post COVID-19, and you'll have to react to that. The process of due diligence, for COVID relief has to be very lean. Like I said, we put out very, very basic structures, and you should also use your network very, very strongly to be able to get that, data from a due diligence perspective. And we all have to ensure that we do not miss the bus on either process or compliance just because it's a stressful situation. We still have to keep the fundamental principles of impact, of good program design, good due diligence, and good monitoring in place to be able to get the impact that we want. Uh, I will probably look at, in terms of maybe one more question from the group, and then we may have to kind of come back um, for more points at this time. I think there's one question on, there's a concern that we're facing in identifying small but credible NGOs that we can support in their efforts to provide relief for affected families. I think we have a fantastic network of small organizations and, small NGOs. If you have trouble in reaching out to any part of the country with any of the organizations, in terms of in a credible way, please reach out to us, and we'd be very, very happy to again share that network of NGOs in different parts of the country, big and small, and how you could potentially work with them with as much data as possible. The last question, given that most of the organizations, HNIs, individuals are all contributing, I would like to understand what kind of visibility do corporates or individuals will have when they donate, and how do we know it's reaching the needy? So I think this is where, like we said, extremely critical to have a structured, due diligence and monitoring approach, and that also has to be lean and cost effective. We've done a lot of work on that in the last few days. So like I said, very happy to share that, with this group, as much as we can. Um, if we're completely out of time, I think there were at least another 50, 70 questions that came up, which we could have easily gone for another hour or two and we could have discussed and answered. My apologies to that. I hope, this has been useful in some form. Like we said, we will be sharing our dashboard and all the data and, and the part of the collaboratives that are emerging. Please reach out to us if you have any questions. We will make sure that this presentation is sent to you, and we will also make sure all the answers, for all the questions that have come up, which is over 150 plus now, we'll make sure the answers, both from a compliance point of view and from a, from an impact point of view, are answered and sent to you over email. And post that, if you need anything, please do reach out to us, and we will be able to answer them. I think in just summarizing, extremely important time for all of us to work together, and respond. This ecosystem is part of the frontline workforce, and I think this sector has to kind of be at the forefront of fighting this current crisis. So good luck to all of you. More power to you and your teams for all the great work you're already doing. Whatever we can do to support, please don't hesitate to reach out to us, and we'd be more than happy to jump in and support at any point in time. Thank you very much for your time and attending the webinar. Really appreciate it. We will be in touch. Good luck.